Hi there, I'm Wendy McCallum, burnout and alcohol coach and wellness expert, and you're listening to Bite Size Balance, where everyday extraordinary women share their stories, expertise, and wisdom, all in the name of lifting each other up and creating a better life by design. Whether it's wellness, career, relationships, food, alcohol, mindfulness, hormones, or parenting, we talk about all things women's balance. If your life looks great on paper, but it still feels like something's missing, you're in the right place. Welcome to Bite Size Balance.
Hello, everyone. I am back with another episode of Bite Size Balance. I'm so happy to be here. It is actually the beginning of April. That in itself is making me very happy. This feels like the longest winter ever here on the east coast of Canada, but it does feel like it's starting to become spring here. There are actually some little crocus buds popping up in my garden bed that I noticed yesterday. So registering some gratitude for that today. I have a great guest here with me today. Dr. Jenn Salib-Huber is back. Jenn has been on the podcast a few times. She's a really popular guest. Jenn is a naturopathic doctor from Canada, currently living in The Hague in the Netherlands, and she is also a registered dietitian and an intuitive eating coach. So today what we're going to be talking about is we're going back to one of the most popular topics on this podcast, which I will continue to revisit from different angles in order to provide you guys with more and more information about it. We're going to be talking about perimenopause and menopause and what happens during those years for us as women. And in particular, Jenn is going to shed some light on what we can do from a dietary perspective to really support ourselves as we go through these hormonal changes. I have talked to Jenn about this before. In fact, Jenn and I used to have a program that we ran together many years ago now called Menopause Matters, which was a really short course that we put together. And so I know Jenn's an expert on this, and she has so much really interesting, practical information to share about the connection between nutrition and particular types of foods and compounds in foods and some of those symptoms of perimenopause and menopause that so many of us are struggling with. So if you're between the ages of I'm going to say 40 and 60, this podcast is for you. It probably will benefit you if you're younger than 40 and if you're older than 62, because I think, if I could go back, the one thing I wish I had was more information before my hormones started fluctuating in perimenopause, which for me started in my early 40s. I am now, as many of you know, in almost full menopause. I will, in fact, be celebrating my Menoversary, which is my 1 year since my last period. I'm going to celebrate that online because I do think it's something to celebrate. And I'm going to do that with my dear friend, Dr. Sarah Bailey. She's coming back. We happen to share a very similar Menoversary date. And so we thought, how much fun would it be for us to get back together, talk about some more stuff in relation to hormones and women's transition into menopause and all of the spiritual and emotional stuff that goes along with that in celebration of our joint Menoversary. So stay tuned for that episode. It is coming. But for now, I hope you really enjoy this conversation with Dr. Jenn Salib-Huber. Hi, Jenn. Welcome back.
Hi, Wendy. Thanks for having me.
I'm so glad to have you here again. One of the things I realized we've never talked about is the connection, specifically anyways, the connection between the types of food that we eat and some of those symptoms that we associate with perimenopause and menopause and hormonal shifts. And I know that so many of the listeners are really enjoying these podcasts that are focused on the hormonal side of things. And I thought you'd be the perfect person to come back and talk about food in relation to perimenopause and menopause.
Love to.
Yeah. So I'm excited about this. But before we talk about that, I have lots of questions for you on that topic. But before we didn't get into that, we were having technical difficulties here before we got started. And that gave me 5 minutes to go scroll through your Instagram feed, which I follow and see every day. But I was back historically somewhere and I saw a post about Meno Rage, which, as I believe you know that I've shared this with you personally, was one of my main symptoms in perimenopause. It has, thank God, died down now, now that I've moved into menopause. But
congratulations, by the way.
Oh, well, I'm not quite there yet. So I guess I shouldn't be saying it out loud, but I was just saying in my intro, Sarah Bailey and I, who I know you know, Sarah and I are sharing basically a Menoversary, which is very serendipitous and kind of feels kind of cosmic because, of course, we've been talking about menopause on this podcast together now, done a bunch of episodes, and she's kind of a regular guest. And we realized that we're only about 2 weeks apart. So we're both hoping we make it. And our plan is to do like a joint Menoversary episode in a few weeks when we're there. So I am almost there. I'm literally like 3 weeks away. So I better not get my bloody period. But all signs point to me being in menopause right now. So
I always say though, that Murphy and Mother Nature are best friends. And I can't tell you the number of women, and I hate to be the bearer of this news, who have gotten a period at like 11 months, 3 weeks, and 5 days or something crazy, because I've definitely get emails where like, do I really have to reset the count?
Yeah, I know. I'm kind of at the point where I'm like, I don't even care. It doesn't matter. I'm clearly at the end of this thing. And of course, I think I have talked about this on the podcast. Sarah and I are going to talk about this at some point too. I did the Dutch test, which was pretty clear in terms of a hormone test that, there's no estrogen left in me. So anyway, I saw this post on Meno Rage and I thought, oh, let's just talk about that for a second before we get into food, because that level of rage that I used to feel, which was just like, I would describe it as an out of body experience. Like I couldn't stop myself, and I would be set off at like not really the smallest thing, but just the most unpredictable thing would set me off, and I would just lose my mind, and it would take me forever to like pull myself back in from it. And it was really, it was really horrible. My kids and my husband hated it. So I saw a post on Meno Rage. Can you tell people, because I know there are other women out there who are struggling with this symptom of perimenopause, where it feels like you can't control your response to things and you just get so angry at the drop of a hat. Can you please explain how this is not our fault and it is actually connected to estrogen? Can you explain that for us?
So, I think that your description of it being an out-of-body experience is really accurate, because for so many of us, and I definitely still get this, unfortunately, where it feels like this fire in the belly is starting. And in the moment of that reaction, you kind of know you're overreacting. Like you can see it happening and you already know that you're going to regret your reaction. You're going to be at the end of it and be like, oh, why did I lose my proverbial shit about this? Like, this was not worth it. What happened? I don't understand why I reacted this way. So I think that understanding the why helps us to gives it context, right? So it's not because we're that stereotypical kind of crazy woman in perimenopause. It has to do with how our brain filters emotion. And the part of our brain that filters emotion is called the amygdala. It's like very deep in the brain. And its main job is to interpret events, circumstances, thoughts, and help us to determine whether or not that thing is a threat to our survival. That's kind of its main job. So if it determines that something is a threat to our survival, it sets in motion that fight, flight, or freeze, kind of sets that cascade, that ball rolling. If it determines that it's not, then we don't have that reaction. And in adulthood, once we get through the teen years, the part of our brain that we call the thinking part of the brain, the prefrontal cortex, is involved in that conversation. So the amygdala senses something, the prefrontal cortex says, yeah, you should freak out about that, or no, you don't need to freak out about that. And we kind of go about our day. But the amygdala is packed with estrogen receptors. So there are more estrogen receptors in that part of the brain than anywhere else. And we know that estrogen is involved in the regulation of emotion. So when we're in these perimenopausal years, where estrogen is fluctuating wildly, because it's not in a consistent decline like we wish it was, it's kind of all over the place, we literally lose our filter. So we react to things as if they're a threat to our safety and survival, even when they're not. And so that can be anger, that can be emotion, that can even kind of go the other way and just kind of sometimes be not even related to the event. Like that's what a lot of women say, like, I don't understand why I'm feeling this way. Like nothing happened. Well, it's because your emotional filter is swimming in a different hormonal soup. So one of the ways that, we target that is, okay, well, can we try and limit those fluctuations in estrogen? Can we go from the bumpy road to the paved road? And there are lots of different ways that women can do that. So I teach a food first approach and use integrative medicine. Some women choose menopausal hormonal replacement therapy, and that can work really well for them. But the big thing that I want women to know is that if you're only being treated with an antidepressant or an anti-anxiety medication, and it's just being treated as a mood issue, it's not getting to the root. And you're not going to get the kind of relief that you're looking for that helps you feel like you're not crazy. It
Yeah.
has to be treated like a hormonal issue.
Yeah, that's so great. Thanks, Jen. I mean, I feel like other women are listening to this right now and feeling great relief. Like that explanation just makes me feel so much better. It's basically alleviated a lot of shame for me just to understand why I had, like, for so many years, I felt very out of control with that. And that makes total sense to me. I always love a science-based explanation for things. It resonates with me. And I think the people who listen to this podcast are the same. And that's probably why they listen to this podcast. So I love that. Thank you for sharing that. And that is a perfect segue into this kind of food first approach that you advocate around, just supporting women's wellness generally, but also around trying to support and manage as best we can all of these hormonal fluctuations that are happening. So let's start maybe with like a really general question, which is, how can food impact how we feel? Like, what is that connection between food and hormones in a really general way? And then we'll get into some specific foods, but just generally.
So I think we want to back up a little bit and talk about what some of the hormonal changes are and the impact that they have on kind of what we feel and also on our health. Because when we're talking about food, there's really kind of two realms that we want to acknowledge. One is that many women have and continue to feel like they need to control food to control their weight. So their food decisions have always been based on, I want to be healthy, I want to have energy, I want to do all those things, but I'm mainly doing this to control my weight and hoping that the other things are kind of side benefits of that, right? But then there's the real aspect of, how do our bodies change as a result of the hormonal changes? And what part of that is something that we can control? And what part of that can we use a food first approach to kind of help manage? So the first thing that happens is that we experience symptoms. So the symptoms happen because we have fluctuations in estrogen and progesterone primarily, and then some other things like cortisol can be involved or thyroid hormone changes, but primarily our symptoms like hot flashes, mood swings, and body changes are due to the fact that estrogen is changing. So we can certainly impact that estrogen fluctuation with food. And so phytoestrogens are one of the ways that I do that. Because they bind to one of the estrogen receptors, the one that's protective, not the one that we kind of think is bad when we hear about estrogen receptor stuff. And that's the beta receptor. And activation of that beta receptor can definitely help to improve our symptoms and can also help to alleviate some of the longer term, I guess we'll call them consequences of being in an estrogen deficient state. And so one of the things that also happens is insulin resistance, which is basically kind of a change in our metabolism at the cellular level. So it is a change in how we store and use energy that we get from food. And so a lot of women will, kind of fear this because the diet culture message around insulin resistance is weight gain, right? And so they will use weight as a proxy for health and will kind of use their food choices to try and control their weight and hope that their health improves in the end. But we can use a weight neutral approach to including more protein, including more fiber, including phytoestrogens to try and mitigate the effects of the insulin resistance and limit the consequences of it and really keep weight out of the front rows. We can focus on these changes using gentle nutrition. How can we include them more often in ways that you enjoy, in ways that fit into your life and your family's life, so that you're not constantly feeling like you're making separate meals and adding more stress to your life? And we can do that in a way that feels intuitive and natural. It doesn't have to feel like it's something that you're constantly working at, because I think that's the experience most women have with a food first approach, is that it's something that they always have to be working at and working towards and thinking about and planning for. And that doesn't serve us in midlife. So in midlife, we want something that feels natural in the sense of it feels intuitive. It works with us. It works for us. It's not another job that we have to constantly be working at, right? And looking for one specific outcome. So yeah, so the food first approach really changes in what we're working towards, but the food first approach is also about how can we make this fit in your life? Like this isn't, I don't want to add more stress to an already stressful experience.
Yeah, no, that's great. I totally agree with everything you just said, by the way. And that is definitely the approach that I've always taken, is this idea of like, if you can't figure out how to make this work in a practical way in your real life, then it's only going to add stress to your plate. It's only going to contribute to burnout and adrenal fatigue. It's only going to make things worse. And it's probably only going to, it's certainly not going to help a weight loss. Let's put it that way. It's just going to lead you, it's going to keep you in this cycle of feeling like you can't do it and you're failing and whatever. So I love this idea of kind of backing off of that and figuring out how to make this practically work. So just carrying on from that, my next question is, how do women do that? So if you're listening to this podcast and you're thinking, well, I'd like to make some changes around the way that I eat for a variety of reasons. One of them is I'm not feeling so hot, and I would love to see whether changing the way that I eat might have an impact on some of these symptoms that I've been having. How do you shift out of that mentality of, what's the opposite of food first? Weight loss first? I don't know. How do you shift?
I guess so, just like a diet mentality.
How do you shift from that diet mentality into this kind of food first thing? Like what needs to happen in order for that to work for women?
So the first thing that I always do is really back up and explain what's happening. So there are the key changes that happen as estrogen levels decline is that our metabolism slows, it changes, it becomes, different than at 20 and 30. And that happens to everyone, but it does happen to women a little bit differently. It becomes a little bit harder to maintain lean muscle mass and to put on lean muscle. And so in order to do that, you need to kind of consider how doing that will impact your life long term, which is in so many ways other than weight loss, right? So if we can maintain and build lean muscle mass, and we're focusing on health, not weight, that's going to help us to remain mobile. It is going to, it's been associated with increased quality of life in every decade, the more lean muscle mass that you have. So a lot of it is shifting the focus from weight as being the outcome and the proxy for health to what are the actual health outcomes that we're working towards, which could be blood sugar control, which could be reduced, pain if your joint pain is something that you're experiencing. It could be improved energy, it can be improved mood, but we really want to try and break down, and this is the big part of like the teaching part, the education part of the work that I do, is that weight is not a good indicator of health.
Right.
And for many women, the ability to control weight has always been limited because we're genetically programmed to look a certain way. So 70% of our body size and shape is genetic. We know this from twin studies. Twin studies of twins reared apart, so literally grew up in completely different environments. 70% of their body size and shape is genetic. So if only 30% of that is controlled by environment, why are we putting 100% of our effort into weight loss?
Yeah, such a great question. I love that. I know we've told this story like 4 times, I think, on this podcast, but let's just quickly recap it again because it's so cool. Jenn has a sister she didn't know about who she met. I'm going to summarize it, Jenn, fill in the blanks. A sister who she didn't know about for a very long time, recently met in the last few years, got together with her, and she's literally the spitting image of Jenn. Like they look so much alike. And including how their bodies look, just the look of their bodies. So Jenn's like got her own story around this and evidence to back up this idea that the overwhelming percentage of what we look like is predetermined for us. And we spend our lives trying to control it and change that, but you can't change genetics. So take a little load off of yourself and maybe start thinking about, I love, Jenn, this way that you describe it as like looking for these other motivators, other reasons or measures for of success around food. I have always done that. One of the things I said, I don't do weight loss anymore. As you know, it's not a primary piece of my business anymore, but I do help burnt out women change the way they eat so they feel better. And I always have this conversation with them around it. If you're only motivated by the number on the scale, what happens when you get there? That the one thing that was driving you this whole time is now no longer a factor. And if that's the only thing that was motivating you and it's gone, you have no reason to keep doing the things that you're doing. I want people to make changes around their food because of the way that makes them feel mentally and physically, all of it. I want you to experience freedom from food where you're not thinking about it all the time, which is, I think, kind of what you're talking about here. I want you to get into a groove with habits that sustain you and make you feel fantastic physically and also mentally, and that take a load off your plate and make your life less complicated and also give you pleasure. So I think you and I are on the same page on all of this. So once women start thinking that way, then I guess another motivator in terms of change would be, this helps me feel better in my perimenopausal and menopausal years. This helps me manage a little bit some of these symptoms that are connected to fluctuating hormone levels.
Yeah.
Okay.
And, to back up a little bit, I think that there are some fundamental false beliefs that keep women stuck in the diet mentality. The first is that weight loss will protect us from a negative self-image. So we hang all of our hats on that weight loss hook, that once I get to this size, this weight, fit into this clothes, these clothes, I will be happy. I will have X, Y, Z, blah, 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 blah. But all women have had the experience of looking at a picture of their smaller selves, thinking, why did I think I needed to lose weight?
Yes.
So, and that is, the proof is in the pudding. You cannot expect weight loss to solve that fundamental belief that your body isn't good enough until it's a certain size, right?
Yes.
So body confidence is an inside job. It's not a number on the scale. And so the other beliefs that hold women, or kind of keep them in diet culture, is the belief that our weight is supposed to be a certain size, or a certain number, that we are supposed to be in control of that number at all times. And that even if we can get to a place where we can accept our body, we need to be working towards weight loss for health. I call those anti-dieting dilemmas. Kind of, they'll be like, yeah, I love the idea of intuitive eating. I love the idea of making healthy outcome, but... And those are the things that they say, right? And so we need to really change that fundamental belief. And some of that is, my story, that, genetics are a big part of what we do. But that also recognizing that weight is never something we've been in control of. We can be in control of the choices that we make around food, who we spend our time with, how we move our body, how we respond to stress, how we prioritize self-care, how we, prioritize sleep, how we manage any symptoms that we're having. Those are all choices that we have that will improve our health and our experience of perimenopause, but they may not change the number on the scale because we're not in control of our weight.
Yeah, I totally agree with that. And unfortunately, I think a big part of the problem here is the medical standard for health and the connection that weight has played in that. And just the whole discussion around BMI and healthy weight that happens in the conventional medical world, which is really not helpful at all. And what it does not ever focus on, and this is something I have a hard time articulating to women, but what it doesn't focus on ever is what's going on inside. It's focusing on just the number on the scale. That's really all it's focusing on. And if you are eating a healthy diet and, all the foods that you need to stay healthy and energized and all the rest of it, that is actually reflected on the inside of your body. If we could cut you open and take a look, you would see that. And it has nothing to do with the number on the scale. And so I always try to get women to focus on that. Like, imagine you had a mirror on the inside instead of just the mirror on the outside. Like, that's the one that really matters when it comes to your overall health and wellness. So again, we're on the same page there.
So getting back to the original question, though,
I don't know what the original question was, but that's okay. I rarely know what my original question was on this podcast.
But just how can changing your relationship with food have a meaningful impact to your midlife experience?
Yeah.
And I think that is really at the heart of why women, come to me or work with me who are just looking for a change, because they'll say, I've been doing the same thing for 20, 30, 40 years. I can't remember when I wasn't on a diet. I'm always counting something, tracking something, making healthy swaps, and nothing is working. And either nothing is working and I don't know what else to do and I'm here, or I realize that that's not working and I need something different. Those are kind of the two conversations that I have initially with people. And so in addition to saying, okay, let's look at, your health outcomes instead of your weight and make that the focus of what we're doing, let's also acknowledge that midlife for many women is we're in a pleasure deficit. We're in the bottom of the U-shaped curve of life, right? Which I know you know about and, kind of probably can summarize better, but I always say that statistically, we're happiest at the beginning and ends of our life, and everything in the middle can get kind of messy. And you add the hormone changes on top of that, and we're kind of in a pleasure deficit. And that's not even mentioning COVID. So we have a need for pleasure, and we have a right to experience pleasure regularly. And I try and see the opportunities to eat and to enjoy food as daily opportunities for pleasure and satisfaction that contribute to my overall well-being and my overall experience of midlife. And, trying not to pathologize the fact that, sometimes you want chocolate for lunch.
Right.
That's not a crime. It's not a lack of willpower. It is your brain that is saying, hey, I have a pathway and I'm going to make you go down that pathway because we've done it 1,000 times. And if you've never thought about the other ways that you can experience pleasure, you're just going to keep going down that pathway.
Yeah.
So what I try and teach women is that, your brain is wired to avoid pain and seek pleasure. A lot of midlife is crappy for all kinds of different reasons. And you will best serve your short and long-term health by figuring out what works and feels good and just keep doing it over and over again.
Right.
So that's kind of how I approach food. It's one of the ways that we can experience pleasure and satisfaction to support our well-being and our health.
Yeah, I hear what you're saying. I think that's great. I mean, I talk a lot about that on this podcast, talk a lot about like alternate ways to healthy ways really to up the amount of joy in your life. And I think that there's a huge connection between figuring that out and relying less on unhealthy coping mechanisms. So I am again on the same page as you, no surprise there.
I also try and reinforce, that in the moment, emotional eating is self-care, because emotional eating comes up a lot.
Of course.
And, that in the moment you are responding to your body's needs. And, we just want to try and see how else we can do that.
Yeah.
So there's no need to beat yourself up. And I know you teach that too. This is just about recognizing, why do I do it this way? How is it actually working for me? And what else can I try that might be a better solution in the long term?
Yeah, absolutely. Which is really just coming back to that thing I talk about all the time, that idea of that experiment mindset. So ditch this idea that you already know all the answers, because you don't. It's not working for you. Whatever you've been doing for the last 30, 40 years has been making you feel terrible about yourself. So throw that out the window and get into experiment mode. How do I actually feel when I do this thing or I eat this thing? And what is it that I'm feeling before I want to eat this thing? And does it actually make me feel better? Sometimes it probably does, but sometimes it doesn't. And so if it doesn't, what was it I really needed in that moment? Because it probably wasn't the food. And how can I figure out how to get myself more of that more often? Okay, let's start talking about the specifics here, because I know you have lots to share about the types of foods that we can incorporate, start incorporating. I mean, we can be incorporating them well before. And in fact, I think you've told me before, there's benefit to getting these foods into your diet earlier. So if you're listening to this podcast and you're thinking, I'm not in perimenopause yet, that's okay. All of this stuff actually applies just as much to you. I think it's just as important. And some of the shifts that I made in my 30s, I'm convinced have benefited me greatly as I went through my 40s. I can only imagine what kind of a shit show it would have been, Jen, if I hadn't been eating the way I was eating, to be perfectly honest. I think it's the thing that kept me sane through all of it. So what are some of your favorite types or groups of foods that you talk to women about who are looking to try to support their hormones a little better through their diet?
Yeah. So the first thing is these phytoestrogen-rich foods. So these plant compounds that are found in all plants, but are concentrated in beans and lentils, especially soy and flax. So I encourage women to, as early as they can, really. I think that, like you were saying, even before perimenopause, having these just in regular rotation. So whether that's having a meatless Monday and having a bean-based dish, whether it's having hummus more often for lunch, but once you get into the thick of perimenopause, really trying to incorporate soy and ground flax as often as you enjoy, typically several times a week. So I'll talk women through, okay, if you're having hot flashes, 10 times a day, you may want to have a glass of soy milk most days, every day. It's really easy to incorporate that regularly once we have a look at what women are eating. So I'm a big fan of tell me what you like, tell me what you enjoy and what works for your life. And I'll help you to kind of add these things in. So we use an add-in technique instead of a takeaway technique to just really try and kind of get to where we want to go without feeling like it's going to be a lot of work. So if you have cereal, then maybe we're going to have soy milk instead of regular milk. If you regularly make oatmeal, I'll give you a high flax recipe for a baked oatmeal. If you have smoothies every day, maybe we use either soy milk or silken tofu and add flax to it. So it's about really just trying to fit this into your life. So the food first approach is regular doses of beans and lentils, including soy and flax as often as we can.
Okay, let's talk about that. I have 2 questions on that.
Yep.
They're not my questions because I already know the answer, but I know that people listening to this podcast are asking these questions. You already know what the questions are probably.
Yeah.
So the first question is, I think this is the right order to ask them. The first question is, doesn't soy increase our risk of breast cancer?
And the answer is always and unequivocally no.
So the second question is, which is going to be this, is why not? What is actually happening with the phytoestrogens, which are really just plant-based estrogens, as Jenn said, weaker estrogens that are found in plants, but in greater concentrations in foods like soy and flax and beans and lentils. So why does the estrogen in plants not just add to our estrogen count in our body and then, set us off or put us at a greater risk for things like breast cancer? Explain it, please.
Yep. Okay. So here's my elevator pitch on soy. But what I'll say as well is that anybody who, wants more information about this, I regularly address this on my Instagram page. I've got lots of posts talking about it. And I might even make it a highlight because I talk about it so often. So when it comes to soy, here is how it works. Here's how the phytoestrogens work and why we know that they're safe. So we have 2 different types of estrogen receptors that vary in concentration depending on the parts of our body. So there's the alpha receptor and the beta receptor. So I think of these as like door handles, basically. And so some tissues like breasts and uterus have more of one. And then other places in our body, like our brain and our heart and our blood vessels, have more of another. And when people hear estrogen, they immediately think of all the bad things they've heard of estrogen, which is that it's associated with cancer, specifically breast cancer. But what we know is that those 2 receptors have very different effects. So something that binds to the alpha door or the alpha receptor is going to have a very strong estrogenic effect and has been associated with increased risk of certain cancers like breast cancer. And when you hear of like a receptor that, positive breast cancer, they're talking about the alpha receptor. The beta receptor is kind of like the back door. So it's used less often, but it definitely serves a purpose in that it actually helps to balance out the front door. So it helps to balance out the alpha receptor. So when you have something that binds to the beta receptor, it tends to reduce the activity at the alpha receptor. So if you have a few people coming in the back door, you're going to have fewer coming in the front door, but it's also been shown to be protective. So, we know from a science perspective and a physiological perspective what happens when these phytoestrogens bind, because they preferentially bind to the beta receptor. They can bind to the alpha receptor, but they have a much greater tendency to bind to the beta receptor. And studies have shown time and time again that phytoestrogen intake from foods, so I always qualify that we don't have enough data about supplements, but phytoestrogen-rich diets from foods are not associated with an increased risk of any cancer and have actually been shown to reduce the risk of many cancers.
Okay, so why is it, Jenn, that I have I have clients time and time again who say they have been told by their medical doctor, they have been told by their treating the nurse who's treating them in relation to cancer or whatever, their gynecologist. I hear it all the time that women are being told to avoid soy.
I know.
Why is that happening?
There really isn't any evidence for it. And I don't understand, other than that there has just been this persistent message of use caution with anything that has the potential for estrogen activity without fully understanding that it doesn't have estrogen activity at the alpha receptor, which is the one that everyone worries about. So, when women who've had breast cancer are told they shouldn't take hormone replacement therapy, it's because that type of estrogen binds to the alpha receptor. So it is like a completely different level of activity, because that beta receptor activity from soy is 1/1000th the strength of our own activity. And when estrogen binds to the alpha receptor, which is far less often, it's still 1/200th the effect of our own. So we're talking about weak estrogens that have a weak affinity for our receptor. And the reason why they're so critical and helpful is that they act as anti-estrogens when we're swimming in hormone soup and estrogen soup and those crazy perimenopausal years, and we're having heavy periods and mood swings and all that kind of stuff. But when we get to the end and we're in the waiting room for menopause and our estrogen levels have really tanked out and will be low for the rest of our life, they actually help to fill in some of the gaps and can act as a pro-estrogen in that situation, which your brain, your bones, and your heart will thank you for in 20 years.
Yeah, that's great. Okay, this is leading me. I mean, as some people listening to this podcast know, I have a background in nutrition. I practiced as a nutritional consultant for many, many years. So this is leading me right into the fiber discussion because beans, lentils, legumes, flax, all really high in fiber, great sources of fiber. And can we talk about the connection between recycling of hormones and fiber? Is that playing in here as well? When we're talking, seems to me like a second benefit of incorporating more of these types of foods as a perimenopausal or menopausal woman.
Yeah. So as we break down hormones, our liver will break down our hormones, and some of the pieces of those hormones will make it into our digestive tract. And as they get to the lower part, so they're about to be eliminated through a bowel movement, there's kind of a last chance recycling mechanism. And it's kind of a patch of tissue where anything that can be reused gets reabsorbed and sent back to the liver to kind of be repackaged. And in general, that's a great thing, right? So it's how our body conserves energy and is trying, waste not, want not. But the problem is that for some women, it actually contributes to these fluctuations in estrogen. And if we are including a lot of fiber, specifically certain types of soluble fiber, like those found in beans and lentils and flax, it can help to bind those metabolites so that they can't be reabsorbed. So it's another way, in addition to the phytoestrogen activity, that including these foods regularly can help to offset those crazy fluctuations.
Yeah, I always say, think of soluble fiber, you guys, as a sponge. And, if you have a dry sponge and you put it into a bucket, it absorbs the water in the bucket. Guess what's floating around in the water in the bucket? The extra estrogen that your body's done with and really wants to eliminate and not reabsorb if you're in flux around this. So, and that it's not just estrogen, Jen, it's other hormones as well. And, including cholesterol. So it can be, increasing the amount of soluble fiber in your diet, just generally across the board, is a great thing. But I can see that is also just another reason to incorporate more beans, lentils, legumes in your diet. Now, there are going to be people listening to this podcast who are saying, I guarantee you, I've been around this block, as have you. It's not my first rodeo. They're going to be saying, I can't digest beans. I can't do it. I eat them. I get, I get bloated. It's uncomfortable for me. I have excess gas. I can't do it. What are your recommendations around how to incorporate more beans and legumes in your diet if you're somebody who struggles with digesting them?
So most of the time when people experience that type of reaction, it's because they aren't having them regularly enough to support a population of bacteria in their gut that can handle that increase in fiber. So as a result, those bacteria go crazy and they produce all kinds of gas that we experience as gas and bloating, and it can feel uncomfortable. So if you are going from never having these foods and want to build up to 5 times a week, you want to start with like a couple tablespoons twice a week. So I usually suggest starting with have some hummus on your lunch plate or as part of your snack. Maybe add a cup of chickpeas to your chicken dish so that you're getting a bit of the extra fiber with it. Using them regularly in increasing amounts will help your gut bacteria to adjust. So kind of low and slow. Yeah. And most people can do that within a few weeks. So this isn't like a 6-month introduction plan. This is really just about consistently including them, but also just paying attention to, how often or the dose that you're having. So, if people are having, a couple of tablespoons, you can, and are tolerating that, you can probably tolerate a full serving of 3/4 of a cup or, something like that. And then there are digestive enzymes. So sometimes people will include those as part of this introduction phase or just have them one hand, if they feel like they need a little bit of extra support in the bloating department. But if bloating persists, if that gas persists beyond that, then that might kind of warrant, kind of working with someone from a functional perspective to see if if we need to address, kind of the gut microbiome, or if we need to look at digestion, on a bigger scale.
Yeah. But for most women that I've worked with, what I've seen clinically is that it just takes time. And the biggest mistake we make is, and this is just another reason not to do an extreme quick fix diet, because the thing that happens with that, when people are like, I'm going to do it and I'm going to do it all right now. And they start eating, 7 to 10 servings of fruits and vegetables, including cruciferous vegetables in every meal, eating a, serving of beans every day, is that it is really hard for them to digest. It's just too much all at once. So take it slow. This idea of habit stacking that I talk about all the time is perfect here. Like, just make one small change at a time, work on it for a while till it feels good, and then incorporate the next thing. Okay. So that actually, thank you for that explanation on soy, Jen. That's so helpful. I feel like we could have that every podcast episode. Like, we need to hear that. The reason why this is, we have so much misinformation about this, I think, is because there was this huge media craze about this, years ago. And those things stick around if they get enough press. They just stick around and they keep getting recycled, that content. But I also don't want to paint all doctors with the same brush on this stuff, because I know, I have had clients who have also come to me and said, my doctor actually told me that soy is great, and to, try to start incorporating soy. So it's not everyone. I feel like there's a lag in education in this. And I know it's changing. It's just changing slowly. So thanks for sharing that.
Nutrition education for all medical practitioners is very low.
Oh yeah.
Right?
It's like 2 days, I think, or something, if there are 2 days of their 4 years in med school or something. Yeah.
And so I think that, there's just, a lack of understanding of, how these things work. And it's not, it's not intentional, but there is a lot of kind of semi-intentional efforts to deceive on the internet, as I call them, where people have a little bit of information and a little bit of personal experience and try and turn that into advice. And that's a really dangerous thing, because, the plural of anecdote isn't data. And if we can't take one person's experience and apply it to everyone. So, when you read stories and then people will say like, oh, well, I read about this one person who started having soy milk and then all of a sudden, she developed thyroid disease. And so, she blames the soy. Well, yeah. Okay. So there's an association with soy and iodine. So if you're not getting enough iodine, which is a lot of people in Canada, especially anyone in Southern Ontario, less for people in the Maritimes, thanks to our kind of close to the sea nature.
Yeah.
But yeah, we need to kind of factor that into the discussion, but that doesn't mean that soy causes thyroid disease, right? So it's trying to expand some of the misinformation so that people feel informed.
Can you just tell me why people in Southern Ontario have low iodine, please? Because now I'm just curious. Inquiring minds want to know.
Just because of soil depletion. So because there's so much farming in that region, and generally kind of it's thought that the soils are depleted because they're not rotating crops and they're just have over farmed the land.
Yeah. Okay. Makes perfect sense. Thanks. Can we talk about cruciferous vegetables maybe now? Because I feel like I just dropped those in the last thing I was talking about. So let's talk about cruciferous vegetables. Can they play any role when it comes to managing some of these symptoms, these hormonal symptoms?
So cruciferous vegetables are a great source of something called indole 3-carbinol, or I3C. Another kind of related compound is DIM, which I'm not going to try and pronounce because I always mangle when I try and expand on that. But both of those compounds are involved in the liver's metabolism of estrogen. And so for some people, I think that they can play a role, but they're not something that I think everybody needs to run out and start supplementing with. Like, on the whole, cruciferous vegetables are very health promoting for 18,000 billion reasons, right? Everything from high fiber, most of them are green. They've got lots of antioxidants. They're associated with reduced risks of everything. And if you enjoy them and can find ways to include them regularly, great.
Mhm.
But sometimes people will expand that into, oh, well, if this is the compound in broccoli, I don't want to eat broccoli every day, so I'm going to go and take this supplement. And I think that for some women, that may actually do more harm than good, because too much of that might actually reduce your estrogen levels. And
Right.
so, I think that when we're talking about cruciferous vegetables, I always like to say yes, always, if you enjoy them, but don't necessarily think that more is better and that you need to start supplementing with a broccoli supplement.
Yeah. Yeah. No, I hear you on that. I know that Sarah, Sarah Bailey and I work together, have been working together in a professional way to try to help. She's been helping me try to deal with
Yeah.
some of these symptoms I've been having. And for me, that was one of the things. I think my liver was having difficulty with it. And I was having, I was using some of these natural supplements that she had recommended to try to deal with some of the symptoms like the night sweats and hot flashes. And sometimes it was making it worse. And it was because I wasn't detoxifying things properly. So okay, so before we go on, let's tell people what cruciferous vegetables are, because there will be people listening who won't know. So cruciferous vegetables is a huge group of vegetables, including things like cauliflower, broccoli, kale, Brussels sprouts, cabbage.
Yeah.
Got it. I probably missed some. Got most of them, I think. So that's what we're talking about there. And as Jen says, like, we don't need to be dumping those into our diet all at once either, but they are just generally great, healthy foods. So incorporating them regularly in your diet can be helpful, and they may be helpful for certain groups of women who are struggling with certain types of things. Again, there's no one size fits all solution on this stuff,
No.
but there's no harm to eating some more broccoli. So go for it if you like it.
Yeah, exactly.
Okay, what about maybe we can talk a little bit. Well, are there any, first of all, before we get to this, I want to ask you about like foods that we should maybe think about limiting or minimizing. But let's talk, is there anything we've missed in terms of groups of foods or types of foods that you would recommend women think about incorporating more of?
So we didn't talk about flax a whole lot. So flax has a slightly different phytoestrogen profile than soy. Is definitely something that women in midlife want to include more of, but make sure that it's ground. So whole flax doesn't have the same benefit as ground flax, because we can't access the type of soluble fiber if the seed isn't ground up for us. We'll just poop it out, basically. So that's kind of something to keep in mind for sure. And usually women will benefit from 1 to 2 tablespoons most days. So that's kind of about flax. To your question about things that we should maybe think about changing, midlife is often a time when we start to notice that some of our habits, which for some women are lots of coffee, or, kind of in general, a lot of hot beverages, whether it's tea or something like that, and also alcohol, may not be serving us in the way that we used to think that they were, or maybe haven't noticed that 3 cups of coffee now feels like we've had 10. And so when we're looking specifically at sleep and anxiety, hot flashes and night sweats, those 2 things are always at the top of my list to just, get curious about. So if you, out of habit, have 3 cups of coffee before you leave the house, let's try and have 1. Or maybe let's try having half calf, half decaf. I have made it through most of my perimenopause, and I can still enjoy half to 1 cup a day. I definitely don't push it. I don't have a second. If I, want another hot beverage, I'll either have a decaf or a tea later in the afternoon, and that's okay for me. But if I have 2 cups of coffee before 10 a.m., I'm guaranteed to have hot flashes and night sweats. It's just it's not worth it for me.
Yeah.
And the same is true with alcohol. So for a lot of women, they start to notice that on the nights when they have a glass of wine with dinner or a couple of glasses in the evening, that they have difficulty staying asleep. So alcohol helps us to fall asleep, but it doesn't help us to stay asleep because it really disrupts the quality of our sleep. And when you combine that with a hot flash, which can also be brought on by alcohol because it increases our heart rate, it's kind of the perfect storm for a lot of women. And so some women may not have put those 2 together because they do notice that they're more relaxed and fall asleep more easily if they have a glass of wine in the evening, not realizing that they wake up at 3 a.m. in a sweat and then don't sleep well for the rest of the night and then feel more anxious the next day.
Yeah, for sure. So I've explained that before. Let me just quickly explain that. This is my wheelhouse,
Yes,
obviously. So if you're listening to this podcast and you're feeling like, yeah, that might be me, maybe I could benefit from cutting back a little on my wine consumption. And you've maybe been trying to do that yourself, but you've been struggling with that. Kale me, baby. Send me a DM. I've got some ideas for you. But in terms of alcohol, what's happening there, and this is something most people don't understand, is that alcohol, we know it's a depressant as a drug, but it is also a stimulant. So what happens is the brain gets depressed and your brain is always trying to maintain homeostasis. It's always looking out for you, trying to keep things where things need to be in order for you to be at your best. And so it notices when your brain gets depressed, as a result of the chemical, ethanol in alcohol. And what happens is it starts working on balancing that out by releasing stimulants. And the stimulants that your brain releases are cortisol and adrenaline, the two stress hormones. So what happens is you have, especially if you have a few glasses of wine, because women will often say, I don't get it. I just feel super chill when I'm drinking. Yeah, you feel super chill because you keep drinking. So if you have a glass of wine, it relaxes you. And effectively what happens is there's a lag between the depressant effect and the stimulant effect. And most women will have a second glass of wine before the stimulant effect kicks in, or they go to sleep, right? So they have a glass, they feel sleepy, they go to sleep. And then what happens is a couple hours later, that stimulant effect comes in, kicks in. And that is what wakes you up. And that is what causes your brain to race. So alcohol is really not helpful when it comes to sleep, and definitely in relation to hot flashes can be quite triggering for women. So pay attention to that. As Jen said, experiment with that. Is this maybe making things worse for you? And what happens on the nights when you make different choices around that? Does that help you with this? And same thing goes for caffeine. I have, as everyone listening to this podcast knows, had to give up caffeine this year, which was oh man, it was hard. I feel like it was my last little guilty pleasure, but it has made a big difference for me. And I was actually just talking to Sarah Bailey the other day, and I said, I'll probably never bring it back because I'm just used to it now. My suggestion on that is phase it out. So if you're someone who's drinking coffee all day long, start by I'm not going to drink coffee afternoon. I'm only going to drink it in the morning. And then, do that for a few weeks. Again, it's about stacking change. Don't try to do it all at once. You will not feel good. Trust me. And then slowly start substituting in half decaf or, decaffeinated coffee later on in the morning until you get down to, a cup or so a day of the caffeinated. And if you're still feeling like your sleep is disrupted, then experiment with taking it out because it really can make a difference for many women. It's not necessary for everyone, but it can make a difference. And honestly, if you're dealing with some of the gong show that was my life last year with all of these symptoms, it's worth it. It's worth it to try these things. Okay. So foods we should think about, we should pay attention to and start looking at whether there might be a correlation between them and the way that we're feeling, are things like caffeine and alcohol. Chocolate, Jen, for me is another one because of the caffeine and I think also the sugar in it. So I can eat chocolate, but not late at night. I have learned it is not a good thing for me to eat in the evening. So I eat my chocolate in the daytime because at night it will often disrupt my sleep. And I feel like there is a link for me between that and night sweats as well. So,
and caffeine or good chocolate does have some caffeine in it.
Sure.
And one of the other things that happens is that as we get older, our ability to metabolize caffeine slows down. And so I always say that that's why you never see people in nursing homes drinking caffeinated coffee all day long, because one cup literally begins to feel like you've had 3 or 4.
Yeah.
And so if you're having anything with any stimulant in it, and for some people, sugar can feel like a stimulant and have that effect, then yeah, you're going to have a more difficult time metabolizing it in the way that you would have when you were 20.
Yeah. I've totally noticed that. I need to just be careful about that. The high sugar stuff in the evenings is not great for me either. And as Sarah Bailey describes it, she just talks about this shrinking window of tolerance, like what we could tolerate, in our 20s and 30s, that the window of that just kind of shrinks so that we find ourselves in this place where, a lot less of the same substance causes the same effect. So, we just have to reduce this stuff. For most of us, I think it's just a reduction. For some of us, it actually really does benefit us just to eliminate it altogether. But again, that's tricky. Don't do it all.
I love what you said about chocolate, about how I know that it doesn't agree with me in the evening, but I still like it. So I just enjoy it earlier in the day. That's a perfect example of the gentle nutrition approach and intuitive eating, right? So it doesn't have to be all or nothing. Yeah. Just because something doesn't have the effect that you want doesn't mean that it's bad or that you're bad for wanting to still have it as part of your life. Yeah. And so, it's all about trying to see, well, where does this fit? And how can I make it fit in a way that feels like it's helping me? me and not hurting me. And so, that's a big part of what we do, even with, like you were saying, caffeine. So I will do the same thing. I'll say, let's try half calf or decaf or trying other things. Or with alcohol, I'll say, just try changing when you have a glass of wine or what type of alcohol. So it doesn't have to be all or nothing. And I think that that's an important thing for women who are interested in that kind of more gentle nutrition approach to managing midlife.
Yeah, absolutely agree with that. I would never have taken caffeine out unless it was a last resort, which 100% was for me. And alcohol was costing me in many more ways than hot flashes, which I think most of the people listening to this podcast know. So I totally agree with you on that, Jen. Okay. Do you have a few more minutes? Because I have a couple more questions. Okay.
Yeah.
So I would love to talk I know Sarah and I have touched on this, and you and I have probably touched on this before, but I think it's really important to just explain to women what the connection is between estrogen levels in perimenopause and menopause and weight gain. Can we just normalize this, please, and stop beating ourselves up over the fact that we gain a few pounds, in our 40s and early 50s?
Yeah. So, and we're pre-programmed to do that. 80% of women will gain on average 15 pounds over kind of perimenopause. And the reason why that happens is, one, our body is trying to protect us from that lower estrogen state. And the weight that we gain in those years helps to produce tissue, fatty tissue that can produce estrogen when we're in that lower estrogen state. So there's a method to the madness. And I think acknowledging that takes a lot of the blame and shame away from us that we're doing something wrong. But also we know that estrogen, as estrogen reduces, it changes the distribution of tissue in our body. So, we go from that typical, what we would call the pear shape of our reproductive years to maybe more of an apple shape. So even if the scale hasn't changed all that much, chances are at 45, you're not going to be wearing the jeans you wore at 25. Yeah. And that's normal, right? We are pre-programmed to change in perimenopause and menopause, just like puberty and pregnancy. And so if you wouldn't tell a pregnant woman that it's her fault for gaining weight, don't tell yourself that at 45. Right? Like your body is doing what it's supposed to do. Yeah. And then we also have that metabolic slowdown that happens to everyone, men and women, and the change in lean muscle mass, which also contributes to that. So this is kind of getting to the understanding of how is my body changing? Why is it changing? And how can I shift my habits, thoughts, feelings, and approach to health to support that instead of fight against it? Yeah. And I think that once women really have, I can't tell you the number of times women will say, no one has ever told me that before. Everyone has always said that you just have to fight harder over 40 and that you better watch out, or that midlife bulge is going to get you, or, and it's kind of like, well, if it's happening to all of us, why do we pathologize it? Why don't we normalize it?
Well, that's why I wanted you to say that on this podcast, Jen, because I want to normalize it. I think it was a really freeing thing for me to understand that it was just my body taking care of me. My estrogen is really low, and it makes total sense that my fat cells would grow a little because they're little estrogen factories, and they're just trying to balance that out for me. And again, probably helped make last year less of a it was a shit show, but less of a shit show maybe than it was. And my body's just doing its best. And I love how I think in one other podcast, I said, it was like my Meno pod or whatever. And you said, instead of thinking of it as a spare tire, why not start thinking about it as a life jacket, which I think is just such a great way to look at it.
When I explain this to women, they will often say, okay, fine, but how can I limit it, or how can I minimize it? How can I make sure that it doesn't kind of go completely out of control?
Right.
And the number one thing that you can do to prevent future weight gain is to not go on a diet, because dieting predicts weight gain.
Yeah.
So there are studies in almost every decade of life that show that intentional efforts to lose weight predict weight gain.
Yeah.
So I'm not saying you have to like it. I'm not saying that you have to love it just because you understand why it's happening. But if I can convince one woman not to go on a diet in her 40s, then, I'll be really happy about that, because that is the number one thing you can do to go with the flow.
Yeah, I totally hear you, which it sort of does tie into what I was going to say, I think, which is one of the things I've noticed as a result of, I really am an intuitive eater. That is really how I eat, as I think everyone knows listening to this podcast. I abhor diets. I abhor extreme approaches, meal plans, portion sizes, weighing, tracking, counting, whatever, all of it. And I did it. Don't get me wrong. I did it for years, but I ditched it years ago too. And one of the things that I think has been a benefit of already having moved into that in kind of place in my brain where it's just more mindful and intuitive around food is that yes, my metabolism has clearly slowed. It has been slowing, I think, for the last however many years. And I think now it is at an all-time low is my guess. But because I pay attention, I really try to pay attention to, I eat when I'm hungry, and I really do try to eat when I'm hungry. That's really my main mantra. If I'm hungry, I'm going to eat. I don't care if I just ate an hour before. And I also don't really care if I'm not hungry, if I'm legit not hungry, I'm not going to eat just 'cause. So what I have noticed, I think, as a result of that mindfulness is that as my metabolism slowed, I need less food. It's just the truth of it. And it's why older women, they say, well, she eats like a bird, because I'm not saying you should eat like a bird. I want to be clear on that. I eat lots of food. But I just am not as hungry all day as I was 10 years ago. Like, it's just a different thing. And it makes sense, from a biological perspective and a physiological perspective in terms of where I am. But I think you run the risk of not noticing that. If you're not, if you're not, if you're on a diet and you're just eating because people tell you to eat, and you're following a plan and you're not making your own choices and you're not listening to your own body around it. So I don't know if you agree with me or not. You don't need to agree with me. It's my own experience.
The biggest dieting falsehood is that we can accurately predict how many calories a person needs on a daily basis, average that out, come up with a formula for them to be in a caloric deficit most days, every day, whatever, and end up with a number. Because the internal regulators of hunger and fullness and weight change depending on the age and stage of our life, depending on our activity level, depending on other things like stress and sleep. And, being able to tune into hunger and fullness is the core of intuitive eating and being able to respond to that, moving away from the prescriptive way of eating that I think a lot of us in midlife were really indoctrinated into, based on, growing up in the 70s and 80s and really kind of being, what's the word I'm looking for? Kind of unwitting participants in this diet culture of these fad diets. It was always, if you do this and eat exactly like this at these times and these things and don't do this, then this will be the result. But if you're eating when you're not hungry, it's not satisfying. If you're waiting too long to eat because you think you need to be hungry enough, you end up with this primal hunger that makes it impossible to eat mindfully, intuitively, and feel satisfied. If you're not honoring taste hunger along with that, you can be full but not satisfied. And so it's about being able to identify those pieces intuitively. And, that takes time, it takes practice, but it also takes some unraveling of your beliefs and the way that you have approached food if it's always been about weight loss.
100%. It took me a long time to unravel a lot of stuff. I was doing it for years after I stopped practicing law. I had lots of weird ideas, not weird, actually, conventional, widely held ideas around food and what I should be doing. And it is not an overnight thing, as Jenn says, but it can be done. And I truly believe that it is really the key to freedom from food, where you're not thinking about food all the time, which has to be the goal, guys. Like, it has to be the goal, not to be thinking all the time, what did I just eat? Was it good? Was it bad? What am I eating next? Is it going to be good? Is it going to be bad? Getting out of that. And the one thing I have learned about food and hormones, and Jenn and I have been talking about this topic for a long time. I said in the introduction, we did a course, we ran a little course together a couple of times years ago on this topic. So I have been thinking about this for a long time and incorporating a lot of these ideas into the way that I prepare food and eat food. But what I have learned over the last, let's say 6 or 7 years of late perimenopause and transitioning into menopause is that your body is going to pretty much tell you what you need. And it will also tell you what you don't need if you just listen to it. And sometimes what I need is a piece of cake. And sometimes what I need is chickpeas. And my body's actually pretty good at telling me that if I just listen to it. So I know it sounds too simple to be true.
fear that people have when they kind of start thinking about how to undiet their life is that, well, if I don't have a framework, if I don't have a set of rules, if I don't have a plan, I'm going to choose the cake all the time. Why wouldn't I? That's the food I enjoy the most. That's my treat food. That's my cheat food, whatever. Without recognizing that sometimes you may not actually want that food and may actually want something else. But if you have predetermined what you can and shouldn't have, you are not attuned to what you need and want in that moment.
Yeah.
So, and most people, when they become attuned, which is what we teach in intuitive eating, recognize that eating that cake every day wouldn't make them feel good.
Yeah.
But never having it doesn't feel good either.
Right.
So, it's about really kind of tuning into like, yeah, when I have this and it's what I want because this is the taste hunger I'm experiencing and it's also going to be filling and satisfying, I feel good. I have the energy to do the things that I want to do. I have healthy poops. I have, my cholesterol is improving. And, there is so much data on intuitive eating that it can help improve health outcomes independent of whatever happens with someone's weight.
Yep.
Because when someone eats intuitively, we don't know what's going to happen. Some people lose, some people gain, and some people stay the same. But the goal is to get you to a place where your body is in tune with its needs and that your weight is relatively stable, that your body size and shape isn't shifting wildly like it does when you're on and off a diet all the time, because that comes with its own risks, right?
Absolutely.
So the goal is to achieve balance.
Yeah. Balance, guys, bite-sized balance. So Jenn, thank you so much. I think this has been a really interesting and fun conversation for me. And I know that my listeners have appreciated everything that you've shared today. So I want to thank you again for taking the time to spend with us today. And I know that people can find you on Instagram. What's your handle there?
At menopause.nutritionist.
Okay. Great feed, you guys. Like Jenn does great posts. They're so awesome. Lots of really great, like little bite-sized bits of information. And what have you got going on now as an intuitive eating coach? Have you got any programs happening?
Yeah, well, so I have my ongoing self-study program for women who are in perimenopause called the Thinking Woman's Guide to Menopause, which is self-study course if you need to figure out what's happening and get some tools to go on to feel better. But I'm also starting a new group program for women over 40 who are looking to undiet their life, and it's called Beyond the Scale. And this is going to be, an intense 6-week, almost, kind of the highest, most amount of information that I am able to share with women in 6 weeks to really take women from feeling like they are stuck in that diet trap and not getting anywhere to developing body trust and feeling like they have the confidence to use intuitive eating as a tool in midlife to not only support their health, but also their well-being, because that's what I'm really all about.
Oh yeah, I love that. I mean, so many women need that. I think that's such a fantastic idea for a program. So if you're interested in finding out more about Jenn's programs, you can get that through her Instagram bio, is my guess, and also on her website, which is what, Jenn?
JennSalib-Huber.ca. And the link is also in my Instagram.
Perfect. Okay. Well, thanks again, Jenn. Have a great weekend.
Wendy.
You've been listening to Bite Size Balance with your host, Wendy McCallum. As a burnout and balance coach, I help busy high achievers like you create a more balanced, joyful life. If you've been putting yourself last for way too long and are worried that you're burning out, grab your free burnout checklist at www.wendymccallum.com/checklist. That's www.wendymccallum.com/checklist.